Well, I grew up in New Delhi, India, and I went to medical school in India at Delhi University, and I was fortunate enough to graduate early enough. I became a doctor at 24 years of age, and I had aspirations to come to the United States, so I did at that age, and basically received further training in New York City and trained in general surgery and ear, nose, and throat at a hospital in New York. The hospital was Manhattan Eye and Ear Hospital on 64th Street, and basically it was a very specific ear, nose, and throat, eye, and plastic surgery hospital. After completing my residency training in New York, I went to Pittsburgh, did a fellowship training in head and neck surgery, and subsequent to that, I came to Mississippi and worked at the University of Mississippi, where I taught and trained several physicians in my specialty, and I assumed the role of chief of ear, nose, and throat there. I left university after practicing for 20 years there, and ever since I've been in practice at Baptist. I'd really like to see more challenging and more complex problems in my specialty. And for that reason, my specialty has evolved, my practice has evolved to seeing more advanced sinus problems, more advanced head and neck type of tumors or cancers, more challenging reconstructive problems. So even though I practice general otolaryngology, most of the patients I observe in my practice are people who have more advanced or complex problems. Well, the philosophy for patient care is what most doctors really try to strive for, which is combining excellence with compassion. And, medicine happens to be unlike any other commodity, and you have to practice it with great amount of prudence, caution, and really true compassion for people. My purpose in medicine and my goal in medicine is really to try and help each individual patient who walks into my office or who walks into the operating room with me, and I want to make sure they get the best care I'm capable of delivering.